Did you know that mental health can play an important role in determining the overall health of your heart? Conversely, did you know that a healthy heart can help you protect your mental health? In this video, we will highlight the interaction that exists between the mind and heart, and how this interaction can negatively affect some groups within the general population. More importantly, we will teach you ways to protect both your heart and your brain. But first, we have to understand how exactly the brain and the heart are connected. Picture the following scenario. You are walking in your backyard and suddenly you see a snake. You feel your heart beating rapidly and a sense of nervousness that has you on edge. What you're experiencing is a response from your autonomic nervous system, the part of our peripheral nervous system that is responsible for controlling how our bodies will react to different situations. The autonomic nervous system can be subdivided into two branches, the parasympathetic nervous system and the sympathetic nervous system. The parasympathetic system is mostly responsible for the activities that our bodies do in non-stress situations, so we say that it is in charge of rest and digest functions. On the other hand, the sympathetic system normally prepares our bodies for high-stress situations, which we call flight or fight responses. The autonomic nervous system accomplishes these responses by causing the release of special molecules, called hormones, that can affect different organs within the body to change how they function. In the case of a flight or fight response, these hormones interact with your heart and your arteries to cause increased blood pressure and heart rate, and also help release glucose or sugar into the bloodstream. The increased blood and energy supply that comes with these changes is perfect if we must react quickly to any possible threat or high-stress situation, hence the flight or fight name. But what happens when you don't allow your body to shut off this response? In other words, what happens if you are constantly stressed?
Often in our lives, we face acute stressors. Acute stress is stress that occurs over a short period of time. This type of stress can be useful to help avoid dangerous situations or make a deadline. Running into a snake may not be too common in some areas, but it is a great example of an acute stressor. Stress comes in all different forms, and they often appear in our everyday lives. Chronic stress is stress that lasts over a long period of time and can cause serious health conditions. Examples of chronic stress are job insecurities, low socioeconomic status, and racial injustices. It is not always possible to eliminate or modify these factors. With chronic stress, you are in a constant state of alertness and your body does not get a break. The constant stress creates a new normal for your body, which can eventually contribute to the development of hypertension or other forms of heart disease. Unfortunately, mental health is something that is frequently unaddressed in minority communities. Minority individuals may experience symptoms that are undiagnosed, underdiagnosed, or misdiagnosed for cultural, linguistic, or historical reasons. African Americans in particular often receive poor quality of care and lack of access to culturally competent care. The African American population disproportionately suffers from hypertension at much higher rates than whites. The reason for racial disparities in hypertension remained unclear. However, it is clear that socio-demographic factors have a large impact on health outcomes. The next topic we will be discussing regarding mental health and how it impacts cardiovascular health will be the topic of anxiety.
What is anxiety? Anxiety is a feeling of fear or apprehension about what's to come. Anxiety disorders differ from normal feelings of nervousness or anxiousness and involve excessive fear. They are the most common mental illness in the United States, affecting 18.1% of the population every year. Anxiety disorders are common in patients with heart problems and have been associated with the rate and progression of cardiovascular disease. However, the relationship between anxiety and cardiovascular health is complex. There are many ways through which anxiety disorders may influence cardiac health, biologically, behaviorally, and psychologically. When someone is constantly anxious, the physical symptoms of anxiety make their body react in ways that can put extra strain on their heart and cause wear and tear on their body. This can be very damaging, especially among individuals with existing cardiac disease. The socioeconomically disadvantaged population can suffer from increased wear and tear and its consequences. Inflammation. Inflammatory pathways play a key role in both the development and progression of cardiac disease. In one large study of healthy adults, individuals with elevated anxiety were found to have higher levels of inflammatory markers in the blood. Further, notable anxiety disorders have been linked to increased inflammation. Health behaviors may explain part of the link between anxiety disorders and cardiac health. Individuals who experience anxiety appear less likely to engage in healthy behaviors. They tend to have high cholesterol intake, sedentary lifestyle, and decreased physical activity. These unhealthy behaviors can lead to the development or worsening of risk factors, including diabetes, hypertension, and obesity, which all can increase the mortality in patients with cardiac disease. Social and economic disadvantages can affect health behaviors and contribute to the cardiovascular risk among the poor and racial ethnic minorities. Racism, discrimination, and oppression are associated with elevated blood pressure and markers of inflammation, which, as previously discussed, influence the development and progression of cardiac disease.
We've established a connection between our nervous and cardiovascular systems, as well as how various stressors affect your heart. Now let's explore how depression impacts your cardiovascular health. Depression is often characterized by an extended period of sadness and disinterest, coupled with changes in sleep, appetite, concentration, energy level, daily behavior, and self-esteem. Over 264 million individuals worldwide suffer from depression, and depression boasts a 0.5 irritability rate. Depression stems from abnormal levels of brain chemistry, but is also linked to genetics and underlying medical issues. Those who are depressed also have increased inflammatory markers and poor lifestyle habits that contribute to increased cardiovascular morbidity. Thus, there are a few common cardiovascular diseases in which depression plays a significant role. Hypertension, a condition in which the force of the blood on the arterial walls is too high. Coronary artery disease, in which the coronary arteries are narrowed or blocked via atherosclerosis, which is the buildup of cholesterol and other fatty deposits on the interior walls of the arteries. And myocardial infarction, the medical term for a heart attack, which occurs when blood flow to the heart is blocked due to a blood clot caused by atherosclerotic plaques that rupture and cause the heart tissues to lose oxygen and die. All of these cardiovascular diseases are significantly influenced by depression. Depressed patients experience an estimated 42% increased risk for hypertension. People with depression often have poorer outcomes of coronary artery disease. Depression is just as significant a risk factor for developing this disease as other classic risk factors. Symptoms of depression manifest in a third of patients who suffer heart attack. Furthermore, people that experience heart attack in conjunction with depression have a higher mortality rate within the 1-year time frame after their cardiovascular event. While a causal relationship between depression and cardiovascular disease is difficult to establish, we do know that preventative medicine is often the best medicine. In people with pre-existing heart disease, those who are depressed are less likely to be compliant with their medication regimens and are less likely to follow up with their cardiologist, contributing to poorer cardiovascular outcomes. Thus, effectively managing depression could decrease the likelihood of negative heart health outcomes. Cultural influences also impact how people manage and seek treatment for mental illness. Racial minorities are much less likely to seek help for mental health issues. Therefore, there is a much higher possibility of their depression influencing their heart health. Thus, it is important to understand the cultural mindsets and preconceived notions that you may have about depression and be mindful of this when seeking treatment.
Cardiovascular disease is the leading cause of death worldwide. Psychological disorders have become more common, especially in marginalized populations where long-lasting stress is prevalent. Social determinants such as race, ethnicity, social class, zip codes, and education levels greatly impact the health risks that an individual will encounter in their lifetime. In fact, minority groups are at a higher risk of developing cardiovascular disease than non-minority groups. Why is that? It may be because marginalized communities do not have the resources like accessible hospitals, financial security, and safe neighborhoods that they need to live a healthier lifestyle. Preventative measures are important in minimizing the risks of negative heart health outcomes. Here are 4 tips to help cope with stress, anxiety, and depression that can improve your overall mental and heart health. Long-term studies show that exercise improves mental health and better quality of life overall by lowering levels of the stress hormone cortisol and improving sleep quality. A simple 30-minute walk a day can improve your long-term health. Additionally, yoga seems to have an effect on the sympathetic nervous system to regulate stress response. Studies have shown that yoga enhances mood and overall quality of life. High doses of caffeine can increase anxiety, so limiting intake is important to maintain mental health. Mindfulness is a practice that focuses on the present moment while eliminating the negative thoughts and worries that are a result of depression and anxiety. This can significantly reduce the stressors acting on your mental health. It is important to recognize chronic stress and determine if you may benefit from therapy, because managing mental health is important for minimizing heart disease risks. We've discussed the nervous system, how stress, anxiety, and depression affect your heart, and tips for managing these risks. Here is a list of cardiovascular health and mental health resources.